Why do you do what you do? Or why do you react the way you do? Or have you ever asked yourself where most of your problems are coming from? What are the source? I'm Daki Duba, counseling psychologist, and this is Drive with Daki, where we journey from surviving to thriving in life. And the big question today is, what is trauma? The word trauma is a Greek word that means wound. So trauma is basically a wound. You may not see it, but you are able to feel that pain. Psychological trauma is that emotional response to an event or series of events. And those events are so overwhelming to the point that you may not be able to cope. And it's not just about the event. It's about how our body and our mind process it. That's why we say trauma is not just what happened to you. It's what happened inside you as a result. The event has happened, but then what do you tell yourself? Or what are your perceptions about whatever that happened to you? Some of us have this negative self-talk that is based on shame. Things happened in life and the way you see it is a way that is so negative and that is so irrational, and it may not serve you. So things happen in life, but it's just how we take it. Two people can go through the same situation, let's say a car accident, but they may not cope the same way. And most of the cases, the emotional outcome is totally different, because you find one person would just feel the shock at that moment and leave it at that, while the other person would just relive that moment for the rest of their lives. And anytime something similar or they find themselves in the same situation, that flashback comes in. So they keep reliving that experience. That's why we say trauma is deeply personal. It's not the event that happened to us. It's the meaning that we attach to it. That's why two different people can experience the same event, but then they process it differently. Let's look at the examples of traumatic events that are widely recognized. We call it the big T. When you talk of abuse, we have emotional, physical, psychological, sexual, or even neglect. You also lose parents to either death, addiction, or you have parents who are living with different mental disorders, you have parents who are in jail, or even through divorce. When you talk of social wounds, there are things like poverty, and we also get so much exposed to things like either violence or grief, and other environmental factors like natural disaster, like fire, earthquake, car accident, or military combat, and so on. But trauma is not just what was done to us or what happened or the events. It's also the things that are missing. If our parents didn't see us for who we are, then we struggle to see ourselves. There are these kind of scenarios whereby here you are, but your parents tell you, back then I didn't even want to have a child. That to a child means a lot of things. They can have a lot of stories and a lot of perceptions about what that really means in their world. And then they grow up thinking that actually no one can accept me for who I am. And they have to now struggle to compensate for every little thing. And this is where we also ask for approvals. Your parents didn't approve you back then, and now you have to keep seeking that approval from everywhere, including your relationships. There is one thing that we really underestimate, and that is vicarious trauma or secondary trauma, whereby you are exposed to someone who is going through a trauma, or you watched something that is so traumatic, or you observed people going through some kind of trauma. And these are actually where we really need to be careful, because it's not just the event happening to you. As long as you are having the second-hand experience, then it also affects you. And the kind of people who are at the forefront of this are like healthcare workers, even as psychologists, because of the sessions that we do. We have caregivers and so on. Not everyone who experiences trauma develops PTSD, which is post-traumatic stress disorder. Actually, only 3 to 10% of people transition to PTSD from just a usual traumatic experience. And whether you have diagnosis or not, trauma can affect a lot of things in your life. It can affect how you see yourself, how you see other people, your worldview, the lens that you use to see perspectives, how you perceive things. It can affect a lot of things. So it's always important for us to seek psychological support and use this as kind of a self-care. You don't really have to have a lot of symptoms, or you don't have to have the diagnosis for you to take care of yourself and heal from different traumas. Thank you so much for watching. If this resonates with you, please share it with someone who might also need it. And this is Introduction to Trauma. There is a lot more that we are going to unpack in the coming videos. Make sure you put the bell on so that you don't miss any new video from today. And thank you so much for your support. Please continue subscribing, liking, and sharing the videos to your network. And see you in the next video. Meantime, please be gentle with yourself and take care of yourself. See you.